Hi, everybody. This is a re-recording of a PowerPoint that was done at the end of June on patient advocacy. My name is Kathleen King. I have been doing these videos for just a couple months, and I'm here to share public knowledge about medical information. I'm not giving any specific medical advice. I'm just sharing information that I think is important for most people who are trying to be their best selves and have good wellness and a more active life. I have no relevant financial relationships to disclose. I do actually use the Wiser Health and Fitness platform monthly. And so I always want to thank Liz Saunders for allowing me to do my my Zoom calls over her site. So wiserhealthandfitness.com. Once a month, I'm pretty much on their site as a free webinar. So you're more than welcome to join me there. For my background, just so you know, I'm a mom to 4 children who I say successfully made it to adulthood in that they, for the most part, live on their own and pay their own bills. I was a biomedical engineer before I was a nurse. I have 3 years of traveling nationwide under my belt to different hospital systems when I was helping out with a new piece of equipment and training systems. And I've been a nurse now for 17 years, in addition to my biomedical engineering, with specialties in cardiac and heart failure, but also in the areas of rehabilitation, home care, and training RNs, PTs, and OTs, and home health aides. Okay, let's get right in it. So this is advocacy. So this is about whether you are the self-advocate for yourself, or whether you are being an advocate for somebody else in your family or a friend, or if you might want professional advocacy. And it's funny, this whole thing, you are the center of your own care. So I went to WPI, Worcester Polytechnic Institute, for my engineering degree. And their philosophy around why their graduates make great engineers is this: they're prepared to collaborate with peers across disciplines, from engineering to the arts and sciences to business, to develop innovative and effective solutions to the world's most pressing challenges. Your health, at times, are the world's most pressing challenge, right? For you, it is anyway. And so it's so important when we talk about advocacy. We talk about you, the patient, or me, the patient, and all the things that come into play when we are talking about what areas might help us to achieve our greatest wellness and to achieve the goals of staying out of the hospital, staying out of the doctor's office, and just enjoying life. So those include improving communication, locating resources, which is pretty hard to do unless you know what they are. Health coaching, sometimes that can be through your primary care, sometimes it can be a professional. Mediate conflict, that's a big one. You want one style of treatment, family wants a different style of treatment, and even sometimes doctors, you know, your primary care might have a better suggestion or a different suggestion than your cardiologist. Sometimes we have multiple doctors. So your cardiologist needs to talk to your kidney doctor, needs to talk to your primary care. So we call that your healthcare team. Anybody involved in your overall wellness is going to be part of your healthcare team. For many of us, that's just ourselves and our primary care doctor. For others, it's lots of doctors and maybe a spouse or a close family member or a really good friend. Whatever it is for you, collaboration creates great decision making. When you are alone in your thoughts and Googling, you can kind of get a little lost. And I can tell you that a lot of nurses would say probably freaked out as well. Okay. I just love this quote: help me, help you, help me, help you. If you know, this is a generational thing, but Jerry Maguire was a great movie. And basically Tom Cruise in this movie, this whole idea is he's talking to his client And he's pretty much saying, you keep doing stuff that's making it harder for me to get you a contract. You got to help me help you. Every doctor that you see is literally begging you to help me help you. They cannot help you. They cannot find the best solution. They are not going to offer the best solution unless they get information from you. Okay, so types of health advocates. Who's considered a health advocate? So on the far left, a personal advocate, trusted spouse, relative, friend, or caregiver. Anybody. Doesn't have to be anybody in particular, right? Usually it's helpful if they have some knowledge of the medical field in some way. Professional advocate, that'd be somebody like me. So a clinical, but it could be a non-clinical individual with healthcare experience. So, I was giving this example. I had a client who moved into assisted living. They were using the medication plan. And what ended up happening is one day they notified the daughter that mom was out of medications as of today. Now, the daughter was really upset. She felt like they were supposed to be managing medications. Why didn't they tell her a week before? She doesn't understand. She thought she talked to the pharmacy. Why doesn't the pharmacy have the medications at the facility? What might have taken a number of hours or a couple days for the daughter to try to figure out, I could probably do in about an hour. And part of that's my experience in home care and experience in assisted living. So I knew right away that what must have happened is that the pharmacy was waiting for something from the family. The doctor's office must have called the script in somewhere else. And somehow we had to get all those people connected quickly. So in about an hour and a half, 2 hours, I was able to make sure that the prescriptions that were accidentally sent to CVS got sent to the correct pharmacy that the assisted living works with. That pharmacy talked to the family to get approval. They were able to get the prescriptions from the doctor's office, the doctor's resent, and basically all the medications were delivered later that evening. And crisis averted. And that's just very stressful for a family. And if you don't know the process, if you don't understand that there's different pharmacies for different assisted livings, it can be time consuming and frustrating. And looking at this slide that says types of advocates, what was missing on this slide is off to your right. And what's missing is self. Most of us are our own best self advocates. For the majority of times you go to the doctor or you go and get a wellness exam, you can be your own best self advocate. The time when advocacy starts to become really crucial is for people who are starting to have memory issues of any kind. People who are getting a diagnosis of a very serious illness or a new illness, right? So it doesn't even have to be that serious. It could be a very manageable illness like diabetes. But when you're sitting hearing it from the doctor for the first time, it's very hard to be a great listener. You are filled with emotions. You have a lot going on as you're trying to take in the information. At that point, it's great to have another person in the room taking notes, just taking notes. They don't have to say anything. They don't have to have an opinion one way or the other. They're just for you taking notes so that when you go home and you say, I forget what he said about this. I forget what she suggested I do about this. You have notes, and those notes will be very helpful going forward. So that's a lot of what an advocate does, is that type of thing. So healthcare advocates support individuals by helping them, one, prepare for appointments. So you're going to an appointment. A good advocate might say, do you have any concerns? Do you want to write them down? Is there something that's been nagging you for a year? Sometimes for my own mother, I'll say, Mom, you've been telling me your shoulder hurts for months. Can you please write that down so you don't forget to tell the doctor? Because what happens is the visit is quick. You forget to mention the shoulder and out you go. And then you get to your car and you're like, oh, I was going to ask them about my shoulder and maybe getting physical therapy or a referral or, I'm concerned. So preparing for appointments, critical. Take notes and ask questions during appointments. You are entitled to ask your care team, your physician, your medical person questions. Don't be shy about it. Questions are great. And to be honest, as a nurse, I can tell you that when our patients are asking us questions, when they're engaged in their own healthcare, it's so much easier, so much better in terms of what we can do for them and what their outcome is going to be. Adhere to prescription routines. Oh, this is a big one. What I always say is, if you want to do something different with your prescriptions, then call your doctor or your care team and tell them. Just don't do it on your own. Because the problem is when you do it on your own, you don't have the same background knowledge as a pharmacist who studied for 6 years, a doctor that studied for 8 years, even your nurse who has passed an exam and has to know things about prescriptions. We know what interacts with other things. We can look it up. We know how to look it up. And we kind of intimately know why you're taking the prescription. But you are your own best advocate. If you want to change something, I personally think it's totally within your right to do that. But what we ask is that you call your doctor's office and you let them know. Because here's the other thing. You change your prescription routine, but then you emergently get sent to the hospital. You can't speak because something has happened. And they're going to put you back on all the medications that your doctor thinks you're on. And they're going to wonder what happened because they think you're taking those. And it creates a very bad disconnect, one that can cause actual interactions and actual bad outcomes. So adhere to prescription routines. Understand health conditions and treatment options. Google is a wonderful thing for lots of amazing information. Unfortunately, a lot of us take parts of the information, and what we kind of forget is to check back to make sure that an expert also is on board and kind of agrees with Google. If you read your Tylenol warnings, you'd never take Tylenol again. I mean, it could kill you. Right? Does it kill you? No. Do most people take it without incident? Yes. Is it one of the best drugs we know for taking down fever? Yes. Interacts with almost nothing. However, if you read the warning label, you'd never take it again. So, understanding health conditions, yes, you do your research. Yes, you do due diligence. You talk to people who might have had the same condition, and you talk to your care team, your nurses, your doctors, and talk about treatment options. If they say, hey, this is what we do for X, Y, and Z, well, you can ask, are there other options? We normally give an antibiotic for this. Well, are there other options? Do I need the antibiotic? And they might say, well, you don't need it. You might be able to fight this on your own. And you might say, well, I'd like to try for a couple days. That might be something that you guys come up with as a treatment option together. Okay? When you understand your health condition, then treatment options are also easier to understand. Address health insurance issues. This one's really tough. Most doctor's offices or specialist offices should be able to help you understand what's going to be covered and what's not going to be covered. And they should be telling you what's not going to be covered. You can call your health insurance agency as well. They should have an 800 number on the back of your card. It's always good to have a sense of what's going to be covered and what's not. And then navigate challenging healthcare systems. A good advocate can help you navigate challenging healthcare system processes. For instance, I had a good friend and her boyfriend was actually needing hospice care. He was an older gentleman and he was probably not going to live very long. And he was stuck in the hospital. Family desperately wanted him moved to a rehab, but rehab doesn't want to take him because he's going to die. He's not rehabable. He needs probably hospice, but they don't want to use hospice. And so basically, this poor family is cross-talking to the care manager and to the physicians at the hospital, and the patient is sitting in limbo, not being able to move one way or the other, and quite frankly, not very comfortable. So a conversation with myself could help them to understand what the system needs them to say to get him out of the hospital and to a safe environment. And sometimes it's just words. They need to hear you say, I know he's not going to get better. Or we are comfortable with palliative care if we're not comfortable with hospice care. Sometimes it's just words, and people who don't understand the healthcare system, the processes in place, get bogged down with, I don't know why they're not listening to me. And the healthcare team feels the exact same way. I don't know why they're not listening to me. And sometimes it just takes somebody to understand both sides of that to help clarify the situation and maybe just change what words we're actually using. Okay, so I have this on here. It's a short YouTube video, and I'd like to see if it'll play. It doesn't always play, but over the course of COVID, we have had an absolute increase in the amount of aggressive conversations or aggressive behavior towards medical staff. Being assertive is essential for being a good advocate. A good advocate is going to be assertive across the board. You don't take no for an answer. You're looking for an exact date for things. You're not going to be put off. You're going to get the answers you need in a time frame that is acceptable and respectful of decisions you need to make. However, when you cross over into aggressive, I can tell you, I stopped listening. And it's not just me. We're already calling security, because at this point, aggressive in the medical setting is downright dangerous. We all know where violence has been over the last year and a half, 2 years. So we don't take chances anymore. So I want you to just watch this and think about, when you interact with your care team and you're frustrated, are you being assertive or are you being aggressive? And it's just a great tool for remembering how to get what you need in the best possible way.
Some situations call for you to be assertive, and some people are better at being assertive than others. Have you ever hesitated out of fear that your assertiveness will come across as aggressive? Let's take a look at how you can be assertive without being perceived as aggressive. Well, first, you have to understand the difference between the two terms. Assertiveness is the quality of being self-assured and confident. Aggressiveness is characterized by hostility, attacks, or invasions. But a synonym for both of these words is forceful. And that's really the tipping point between being assertive and being aggressive. It's all about your body language. Now let's start with posture. Assertive posture is when you're standing up straight, your shoulders are relaxed, and your weight is spread evenly on both legs. You want your gestures to be smooth, meaning you want to be viewed as though you're calm and in control. Keep your body balanced. Now that's upright and relaxed. Keep your feet firm on the ground. Keep your body language open. Now, don't show threats, and make sure there are no barriers across your body. Now, being open also includes smiling, accepting, and listening. Aggressive posture is when you have hunched shoulders, your head is cocked to one side, or if you're standing as though you're leaning forward with one foot slightly in front of the other. Your gestures will be angry and fast, and you'll have closed posture, meaning your legs or arms are crossed in front of you. Now, what about distance or where you stand? A good rule of thumb when being assertive is to allow yourself and the person you're speaking to enough room to feel at ease, where you can move when necessary. You want to be close enough to the other person so you can be heard clearly without having to raise your voice or shout. An aggressive distance would be when you don't make yourself or the other person feel comfortable, meaning you're right in their face or you're standing over them. You're not giving them enough room to move freely. Remember, aggressive means you're ready to attack or invade, so this gives you a position of too much power. Eye contact can be viewed as assertive or aggressive. With eye contact, you really need to take the rest of the body language into account to help you determine if they're being assertive or aggressive. When you're assertive, you look directly at the other person you're talking to. You aren't looking up or down, and you maintain eye contact during the communication. So what's it look like if you're aggressive? Well, it can be more of a glare instead of just eye contact. You might side-eye someone, or your eyes might narrow and squint. Even what you do with your mouth can affect how you're being received. When you're assertive, you have a relaxed jaw and chin. And by contrast, when you're aggressive, your jaw is clenched and your lips are tight and pursed. Now let's talk about voice. Your voice, your tone, your pitch, and your volume should match that of your body language. Assertive voice is when you speak slowly, audibly, and calmly. You're not monotone, your pitch changes when necessary, but your voice isn't shaky. Aggressive voice is when you use a loud, angry voice. Your pitch is going up and down, as are your emotions. Let's take a look at a few examples and see if you can tell the difference. Hey, we need to talk about your numbers. Hey, we need to talk about your numbers. That's not my responsibility. That is not my responsibility. But assertive and aggressive behavior doesn't limit itself to face-to-face interactions. We communicate regularly using electronic devices where we just read the information. So the best way to stay assertive in your communication is to write using the active voice. Active voice puts the subject of the sentence first, and the subject performs the action. It's the best way to communicate clearly and concisely. And compared to the passive voice, it makes your communication come across stronger and more direct. Aggressive written communication would also be written in the active voice, but it's the word choice and the way it's formatted that shows the aggression. Instead of yelling at you face to face, they send a text in all caps or bold, and they use a lot of exclamation points. They don't adhere to normal protocols in writing. There'll be no greeting, no please, no thank you. So let's take a look at the two previous examples and how they've played out in the written word. Being assertive allows you to communicate honestly and directly in order to achieve your needs and goals. Assertiveness allows you to recognize another's need, but ultimately do what's best for you. It also allows you to stand up for yourself in a respectful and considerate way. In the end, it leaves you feeling confident about your choices, helps you maintain honest relationships with others, and it facilitates collaboration. Some situations.
All right, so I hope that was helpful. So a doctor visit checklist, I have, two sides here. So doctor visit checklist on your left-hand side. Always make sure you bring these with you, right? And your advocate can help to pull together the information you need. One, an insurance card. Your list of health goals and concerns to discuss with your primary care. A place for taking notes during the visit. Your family medical history. Packages or bottles of medication. I have to say, I don't prescribe to this one. I would say, if anything, take pictures with your phone. If you're taking supplements, I would just take pictures of them. I don't know that I'd bring all the bottles in. If you take a picture of the label and what it contains, you pretty much have what you need. Your calendar in case you need to reschedule other doctor appointments or tests. Not reschedule, but schedule, like, they want you to get a mammogram because you haven't had a mammogram, or you need a colonoscopy. And they are talking about, can we set up the appointment now, or what's a good month? Sometimes having your own calendar with you helps. And then optional, your health supporter, a person who you trust. So if you're going to be your own self advocate, you're going to do all the things on the checklist. If you are going to have a friend or a family member to be, a personal advocate, they're going to help you pull this stuff together, and hopefully they'll take the notes. If you want a professional advocate, you're going to research somebody like me, and you could basically contract me to be at that appointment, either virtually or in person if it's local. And what I will do is then take notes and make sure that all the items on our checklists or on our concerns are addressed. So I might, in the middle of the appointment, say, excuse me, but remember, Sally, when you asked me about your iron, did you want to ask the doctor now about your iron? Just as a prompter. So sometimes that gets questions addressed that maybe you're going to forget. And here are just questions to ask your doctor, right? So if we go to the right-hand side now, how often should I get a checkup? As depending on our age, it's not always a yearly. Sometimes it's more often, but sometimes it's actually less often depending on your age. What screening tests are recommended? Whether you do them or not, it's up to you, but you should know what's recommended and by whom. Is it recommended by the American Cancer Society, or is it recommended by the Academy of Pediatrics, or is it recommended by the Academy of Primary Care Physicians? So it matters. Or family health. I happen to use the family health provider, and so not all the recommendations track to the American Cancer Society. They just don't. So good for you to know that. Is my weight at a healthy level for my height? What health goals should I set? If you don't have health goals yourself, it should be interesting to you to find out what your doctor thinks might be a good health goal. What can I do with my lifestyle to improve my health? Hopefully they're going to share that, but if they don't, it's a great question. Is this over-the-counter medication safe for my child? We'll throw out the child. In general, we're going to be talking about adults here, but I'm taking this over-the-counter medication. Does it interfere with any other medications I'm taking? Is there anything I should be concerned about? And then number 8, we talk about this. Mental health and physical health are combined to create our health and wellness. You cannot separate the two. If you are feeling sadness, anxiety, increased stress, those are things that you need to bring up with your doctor, because one, it could be a sign of a physical condition, not just an emotional or mental condition. But 2, it's worth figuring out whether this is an ongoing problem, whether this is stopping you from doing things you love, whether you might need some increased intervention and or testing to figure out what is going on and why you're having those feelings. This is, it's not a, it's not considered not in the realm of physical health. These are all part of our overall wellness. So we talk a lot about people hiding mental health concerns. You know, if you have sadness every day, it is certainly something you should be bringing up with your doctor's office. They should also be asking you, but you should be bringing it up as well. Anxiety, stress, there's normal levels and then there's excessive levels, and they really do affect your physical health more than you think. And 9, are there less expensive options for my medication? Doctors' offices are becoming much more in tune to this, and they are usually able to help. You'd be surprised. There are almost always some workaround for medication that is excessive in terms of cost. Okay, that is actually the end of this particular webinar. So thank you for watching, and I hope to see you next month.